Hi, my name is Deanne Thompson. I'm the MP student that will be performing your head-to-toe assessment today. What's your name?
Danielle.
Okay. What's your last name?
Valentina.
All right. And your date of birth, please?
10/25/80.
Okay. So before we start your examination, I'm going to wash my hands. And I just ask you to answer a few questions for me. What year is it?
2016.
Do you know where you're at right now?
Yes, I'm in the lab.
Okay.
At University.
All right. And what did you have to eat this morning?
I had a protein shake.
Okay. Can you tell me who the president is?
Obama.
All right. So patient is oriented. Speech is not pressured. Can you please count from 5 back to 1 for me?
5, 4, 3, 2, 1.
And spell the word ball.
BALL.
Okay. So recent memory is intact, and also remote memory is intact as well. We're going to start by assessing the skin. We're going to take a look at it. The skin looks uniform in color. I don't see any areas of cyanosis, no lesions, no visual masses. I'm going to take a look at the back. The condition is the same in the back. Then we're going to be touching the skin, palpating it for temperature. It is warm, it's dry, its texture is smooth. And are you feeling any pain while I do this?
No,
And I'm not palpating any masses or any lesions. I don't see any. All right, so I don't see any swelling, and her shoulders look symmetrical in height. Also, we're going to move on to assessing the hair. So we're going to be taking a look at the scalp. I don't see any areas of concern on the scalp. No lice. Scalp looks conditioned, and hair texture is curly and evenly distributed. I'm going to touch you. Do you feel any pain? All right, I'm palpating for any masses, and I don't feel anything here. I'm going to be moving down to the TMJ. Palpating, do you feel any pain? I'm also palpating the temporal artery. It's present on this side. It's also present on this side. On the right and left side, rather. Now I'm going to be taking a look at the face. Her eyebrows are symmetrical in shape. Her eyes are symmetrical in shape. There's no drooping. There's no paralysis. Her nose is midline. And her lips look pink in color without any lesions. We're just taking a look at the eyes themselves. The sclera is white. The iris are equal in both eyes and central. The pupil size looks about 3 millimeters in size. Her medial and lateral canthus are, they don't look inflamed. They don't look like there's any redness or any swelling. They both look intact on both sides. I'm going to check your lacrimal system. Can you tell me if you're having any pain? There's no swelling there. Also, we're going to check for the smoothness of your cornea. Smooth on the left side. Smooth on the left side, smooth on the right side. We're also going to be checking the conjunctiva. I'm going to ask you to look up for me. Conjunctiva is pink in color. Look down for me. Upper conjunctiva is pink in color. We're going to move on to doing a test for confrontation. I'm going to place my hands behind you, which is also for cranial nerve number 2. When you see my hands come into play, please tell me.
I see.
Okay, great. We're going to be checking for cranial nerve number 3, 4, and 6. Please follow the pen. Do not move your head. I don't see any nystagmus with her extraocular movements, so that means 3, 4, and 6 are intact. I'm also going to check for convergence. Follow this pen. Pupils are constricting and moving midline. So convergence is appropriate. I'm also going to check for accommodation. Please pick an item on the wall, look at it. When my pen comes into play, please take a look at it. Her eyes were accommodating to the object, so that means her eyes are accommodating to objects. And we're going to check for direct and concentric reflex. So I'm checking direct. There's constriction. Now, when I shine the light on this eye, I'm looking for constriction in the opposite eye. constriction, constriction. So her pupils are reactive to light accommodation, and they're equal and round in size. We're going to move on to the fundoscope exam. We're going to look at the internal structures of the eye. Setting the fundoscope to 0, I'm going to be looking for the red reflex, the macula, the optic disc to cup ratio, and also the retinal vessels. All structures look normal in the right eye and also in the left eye. Red reflex is present. The cup to disc ratio is 1 to 3. I don't see any opacities, and the retinal vessels are intact, no AV nicking, and the macula is slightly darker in color. Now we're going to move on to your nose. Her nose looks midline. Again, her NARs are not flaring, so it doesn't indicate any acute distress. They are symmetrical and patent. I'm going to palpate your nose. Tell me if you're feeling any pain. Okay, I'm also going to palpate your sinuses, maxillary and frontal. Any pain? Okay. We're going to take a look inside the nose. Tipping it upward. In both NARs, I'm able to see cilia. I see that the mucosa is pink to red in color, which is a normal finding. I also did not see any septal deviation. Neither did I see any perforation. And the structures inside look intact. Now, we're going to test for cranial nerve number 1. Can you please close your eyes? I'm going to occlude one of your nostrils. Can you tell me what smell that is? Do the same to the side. Okay, great. So cranial number 1 is intact. So far we have checked for cranial nerve number 1, 2, 3, 4, and 6. We are going to move on to doing number 5 because it's just in numerical order. So I'm going to be palpating the TMJ. I'm going to ask you to clench your teeth. I'm going to push back. Don't let me push on it. All right, so cranial nerve number 5 is intact. We're going to move on to the ears. And also we're going to check for the sensory of cranial nerve number 5. Close your eyes for me. Tell me if you feel that. So that's sensory and motor for cranial nerve number 5. We're going to take a look at your ears. Her ears look symmetrical on the same plane as before. No discharge, no redness, no nodules that are noted. I'm going to palpate your auricle. Do you feel any pain? No. I'm palpating the tragus. Any pain? No. Palpating the auricle. Palpating the tragus. Any pain? No. I'm also palpating the mastoid process for any tenderness, any pain. The next thing we're going to do is we're going to do the whisper test, okay? You're going to tell me, you're going to repeat actually what I say. 7. Mm-hmm. 7. Okay. We're going to move on to doing the Weber and the Rhine test. I'm going to strike this. You're going to tell me if you hear and also feel the vibration of the tuning fork in what ear? Awesome. So I'm going to strike the tuning fork and we are going to do the Rhine test, which we're going to place this on the back of your mastoid process. Do you feel that? Yes. Tell me when it stops. Stop. Do you hear that? Tell me when it stops. No. We're going to do the same thing on the other side. That's testing for ear and bone conduction. Her ear conduction is longer than her bone conduction. We're going to take a look inside her ear. pulling upward and backward. On both sides, we see cerumen and also we see cerumen, and we don't see any redness. There's no discharge. There are no lesions inside either one of the ears. The tympanic membrane are both intact, pearly and gray in color. I can see the cone of light. I can see the malleus, and I can also see the pars flaccida. We're going to move on to your mouth next. So that covers cranial nerve number 8 for ears. So I'm going to have you open your mouth for me, please. Say ah. Put up a little bit wider than that. All right, stick your tongue out for me. Move your tongue side to side. All right. Lift up your tongue. I'm just going to touch your teeth. So I was able to visualize the structures inside the mouth. The mucosa was pink in color. There are no issues with her teeth in terms of loose teeth. I just want to palpate your gums. Is that okay? There's no tenderness to the gums. The gums look pink in color. The tongue is midline. Underneath the tongue appears normal in color as well. The hard and soft palates are pink as well and intact. No exudate, no discharge on her tonsils. The tonsils are about a +2 in size rather, and there's no halitosis, and her teeth and her mouth look normal. So we're going to move on to your neck. So we're just going to take a look at your neck. I don't see any masses. I don't see any lesions. Checking both front and back. I'm just going to palpate. I'm checking for the trachea. There's no deviation in the trachea. And before I move on to palpating your thyroid, I'd like to palpate your nose. You're going to tell me whether or not you feel any pain when I do this. I'm doing the preauricular,
No.
postauricular, occipital. Actually, sorry, occipital, tonsillar, submandibular, submental, superficial cervical, deep cervical, posterior cervical, and supraclavicular. I'm positioning myself behind the patient. I'm palpating for the cryocord process. I found it. I'm moving my hand slightly below that to find the thyroid. I'm going to have you swallow for me, please. All right, I feel the cryocord process move up and down. I don't feel any nodules, any masses in the thyroid area. Please bend your neck down to touch your chest. I'm palpating the cervical spine. I don't see any bulging, and I do not see any areas of deformity. I'm going to have you smile for me. Frown. Puff your cheeks up. Raise your eyebrows. Awesome. I'm checking cranial nerve number 7. Stick your tongue out for me. What do you taste?
Sweet, whatever it is.
Okay. So that's checking for cranial nerve number 7. So far we've done 1, 2, 3, 4, 6, 5, 7, 8 for hearing, 9 for 10 for gag reflex with the tongue depressor, 12 for sticking your tongue out from side to side, and now you're going to do number 11. You're going to push up for me, shrug your shoulders. Okay, thank you. We're going to move on to listening to your lung sounds. Just turn your back to the camera for me. Okay, so we're looking for rate and rhythm of breathing. I noticed that her rate was 15, that she's not using any of her accessory muscles, that her chest is rising and falling appropriately, and that her transverse diameter is longer than her anterior posterior. So we've taken a look, we've assessed. There aren't any lesions. We've done that from before with assessing the skin. The next thing we're going to do is that we're actually going to palpate you for any type of tenderness, any pain. We're going to do the front, any pain. The next step is percussion. Noting that there's resonant sounds in all of the lung fields, we're going to also continue with percussion with finding the diaphragmatic excursion. So I'm going to have you take a deep breath in and hold it. We're going to mark the area. Now you're going to take a deep breath out and hold it. Measuring it, it's about 4 centimeters in length. At this time, we are going to also percuss the front. Noting that the sounds over the organs are dull, and in the rest of the lung fields, they are resonant. We're going to check for chest expansion. So I'm going to pinch the skin of the patient up. I'm going to ask you to take a deep breath in. Exhale. I notice that her chest expanded symmetrically, fully symmetrically. So the next thing we're going to do is that we're going to listen. For 1 whole breath in each spot. The next thing that we're going to do in terms of auscultating, we're going to listen to the front. We also need to check for tactile fremitus. So I'm going to place my hands in the same section symmetrically. You're going to say 99 when my hands touch you. 99. We're going to do the same to the front. 99. Vibrations are felt in all lung fields. We're going to move on with a test of for egophony. Anytime I place my stethoscope on you, I'd like for you to say E. We're going to do the same for the front. And the sounds actually sound like E, which is a normal finding. We're going to move on to whisper patriloquy. Whenever I place my stethoscope on you, please say 1, 2, and 3. Whisper it, please. I'm going to do the same for the front. And that is a muffled sound, which is also a normal finding. We are going to move on from listening to her pulmonary system on to doing her cardiac. Please turn around for me. So we're going to identify the 4 landmarks. We have the aortic second intercostal to the right, pulmonic second intercostal to the left, tricuspid fourth intercostal space to the left, and 5th intercostal space, mid-clavicular or mid-axillary rather, is your mitral. We're going to listen for the sound using both the bell and the diaphragm. I'm going to flip it over and now use the bell. Now I'm going to ask for you to lean forward so I can listen to your mitral valve area with the bell. And also the diaphragm. It's present. I'm going to also palpate the PMI. I'm going to ask you to lean forward. I can palpate the PMI. I can palpate the PMI at this location. We're going to go back to laying down, but I need to put the head of the bed at 30 degrees. Okay. All right, please lay back for me. Let me pull out this. Turn to the left. No, just your head. I'm sorry. All right. So what we're doing is that we're assessing for carotid pulsation, which is apparent. Turn to the left for me. Neck to the left. We're looking for the pulsation that is apparent. We're looking for any signs of JVD, which is none. We're palpating the carotid at this time. I feel it. Turn midline. Feel it on that side too. While I'm up here, I'm actually going to listen to your carotid. With both the bell and the diaphragm. Please hold your breath for me, please. Okay, release. So we're going to be listening to the same areas using the bell and the diaphragm. Aortic, pulmonic, tricuspid, and mitral. Now using the bell. All right, while you're in this position, I'll be palpating for the rest of your pulses. So we're going to be palpating for your radial pulse, your brachial, your femoral, your popliteal, your dorsalis pietis, and also your posterior tibial. All right, so I'm gonna have the back of the bed go flat. So can you sit up for me, please? Lay back flat. At this time, we'll be assessing the abdomen. All right, the abdomen looks uniform in color. I do not see any masses or any lesions on her stomach. I'm also looking for the aortic pulsation. I see it. Okay. I'm going to be listening in her 4 quadrants for bowel sounds. Starting at the right lower quadrant and moving my way clockwise. I'm also going to be listening for her aortic pulse as well. I'm also going to be using my bell to listen to any bruits. That's aortic. This is renal. Iliac. And femoral. All pulses are present in that area. I don't hear any signs of any bruits. I am going to now percuss the area, listening for tympany. So all four quadrants are tympanic. I'm also going to lightly palpate the area for any masses. Any pain? Okay, I'm going to move on to deeply palpating. Any pain? The next thing that I'll be checking for will be the liver. I'll be checking for the liver by deeply palpating underneath the last rib on the right-hand side and asking the patient to take a deep breath in. When the patient exhales, I will feel the ridge of the liver going right over my fingers. Inhale, exhale. I can feel the liver edge. Now I'm going to percuss the liver. Marking the area where it becomes dull. And then starting from the top. Again, marking the area where it becomes dull again. And that is about 7 centimeters. I'm going to move on to the spleen. I'm going to be percussing the spleen. I should be hearing the tympanic sound. Please take a deep breath in. Hold it. Release. The sound remains tympanic on that side, which is a normal finding. I'm going to be palpating now for the spleen. I do not feel the spleen, which is a normal finding. The next thing that I'll be doing will be checking for her inguinal nodes. Is there any tenderness? Okay. All right. I'm going to ask you to sit up for me. And I'm going to check for any type of kidney injury by doing the punch test. Tell me if you feel any pain. Okay. Now we're going to move on. Side down to the end of the bed. We're going to check her musculoskeletal system. So the first thing I want to do is I want to test your TMJ. All right, wiggle your TMJ. Are you having any pain? Okay, good. All right. Now I'm going to have you put your neck down to your head down to your neck. Go back. Make a big circle. Okay. Awesome. Come off the chair for me. Please walk towards the camera regularly. Now walk back.
Backwards?
No, not backwards, but walk back to me. And at this time, I'll be assessing her spine. I see normal curvature. I don't see any signs of kyphosis or lordosis. I am going to palpate the spine. Do you feel any pain there? I'm palpating the paraspinal muscles. Any tenderness? Please reach over and touch your toes. Normal curvature of the spine, no scoliosis noted. Please stand up. I'm going to have you lean to one side for me. Now lean to the other. Now can you twist around? Now twist around this way. Now I'm going to have you do range of motion of your shoulder. All right, so we're going to abduct actually. And now I want you to put one hand in front of your chest. Okay, that's adduction. Adduction. I want you to go up straight in the air. That's flexion. I want you to go down. That's extension. I also want you to go like this. Can you mimic me? One hand up above the head and the other one behind the scapula. That's internal, external rotation. Then internal, external rotation of the other shoulder. Now we're going to move on to elbows. So I need for you to flex like this. Flexion, extension. Put your hands in front, hands up, turn them over. Supination, pronation. Now put your hands down. I'm going to have you do range of motion for your wrists. Show me your hands. I need you to go point your hands up towards the sky. That's hyperextension. Down towards the floor. That's flexion. In towards your body. That is radial deviation. Out towards your body. That is ulnar deviation. I'm also going to have you do your fingers. So I need you to put your hands out straight. Spread your fingers. That's abduction. Put them in close. Adduction. I need you to take only your fingers and slightly turn them up to the ear. That is hyperextension of your fingers. And then make a fist for me with your thumb sticking down and out. That is flexion of your fingers. Now, please, let me see your hands. I'm just checking the joints, any swelling, any tenderness. No swelling, no tenderness, no redness noted. I'm checking the metacarpals, the DIPs, and also the PIPs. Please put your fingers together like this. I'm checking for any forms of clubbing. I don't note any clubbing. We're going to move on to your hips. Actually, while you're standing, can you turn towards the camera? Can you do your knee, please? Up, one up, and then extend. And then the other one, up, and then extend. Okay, and then we'll hop on to the table. So what you're going to do is you're going to lay flat for me. And we're going to do your hip extension. So we're going to bring one leg at a time up to your chest. This is flexion, extension, flexion, extension. We're also going to check the internal and the external rotation of the hip. So you're going to bend for me. We're going to push that knee inside. That's internal. Outside, external. Very good. The other leg, same thing. Internal, external rotation. Very good. Any pain while I do that? Okay. Now we're going to actually have you do your feet. So you're going to point your feet up to the sky. Now down to the floor. Okay. Great. Now I'd like for you to actually turn both of your feet at the same time, if you can, in towards your body. That is inversion, and out. That is eversion. That is range of motion of the ankle. I'm going to help you up. And the next thing that we're going to check is your balance and your coordination. Okay? So come off the table. And I'm going to ask you to actually put your hands up. I want to see if there's any drift. Okay, there's no drift. All right, and now I'm going to ask you to close your eyes and put your hands up with your hands facing up towards the sky. No. I'm sorry. Turn them up. Okay. That is Romberg testing. All right. Now, I'm going to have open your eyes. Please walk with one foot in front of the other. Okay, turn around. And now you're going to walk on your heels. Walk on your toes. Okay, very good. Gait and posture is great. Balance and coordination is also great. You're going to look at my finger, touch my finger, and then touch your nose. Okay, balance and coordination are intact. The next thing that we're going to do is, we did musculoskeletal, we did balance and coordination. We need to do your reflexes and also test your strength up on the table. Okay, so we're going to check brachioradialis. Triceps, biceps, brachioradialis, same thing on the other side. Brachioradialis, biceps, triceps. We'll move on to the patella. Then we're going to do the Achilles. And then we do the plantar. We're going to be testing for strength now. All right, so put your hands up, please. Push against my hand. I'm going to push against my hand. All right, push your elbows up. Push up against. No, put them up again. Push down. All right, I'm going to pull forward. Don't let me pull you. Okay, awesome. I'm going to test your legs now. Push up. Push up. Push back. Push back. Now push down on my foot. Okay, push up. Push down. Push up. And now we're going to check for, I think we might have done sharp and dull before, but we'll do it over again just because Now you're gonna check. I'm gonna check for sensory. So we're gonna do vibration, stereogenesis, and also sharp and dull. So you're gonna close your eyes and tell me what you feel.
Sharp. Sharp. Sharp.
Oops. Okay. Tell me if you feel this. Close your eyes. Close your eyes. Tell me what you feel. Okay. And where are we at in terms of time? We're at 35, so we can do a quick review. So we've done all the cranial nerves. We didn't feel for heaves and thrills with how the bed was at 30. So I'm just going to ask you to come back. I'm feeling for heaves or thrills when the head of the bed is at 30. And I believe that I'm finished. Thank you so much.